Good morning and welcome, everybody. I'm Heidi Mastrud, the Director of Alumni Relations for the School of Public Health at the University of Minnesota. I'm going to be moderating today's session. Thanks to all of you who are joining us live today, as well as those of you who will catch the recording afterwards. In a moment, I'll introduce Dr. Dianne Neumark-Sztainer, today's presenter. But before we begin, I'd like to share a few updates and housekeeping notes. I'll try to. Thanks for bearing with us. Just a few tips to begin. For those of you joining us in real time, questions are welcome and you can submit them at any time. I'll be monitoring the Q&A box, so please use that, Q&A, rather than the chat. We'll get to as many questions as possible. If we don't get to yours, sorry in advance, we'll do the best we can. And we will be recording today's webinar and encourage you to rewatch it if it's helpful or to share it broadly after the event. Health in All Matters is a weekly podcast produced by the University of Minnesota School of Public Health to bring more understanding of public health challenges across the globe and close to home. We include expert voices from our faculty and their colleagues around the world. Our premier series focuses on COVID-19 and the many issues it brings into question, such as transmission and prevention, life in a pandemic, loneliness and mental health, and even the supply chain. You can find the podcast on our website or subscribe on Apple Podcasts. And on April 26th, I'm excited to announce that Twin Cities Public Television will premiere Our Invisible Guardians. This is a 30-minute documentary about public health and the many people who work behind the scenes on issues vital to keeping us healthy. Since the film was made a short 5 months ago, COVID-19 has changed our world dramatically, and public health is now far from invisible. Please watch with us and follow the conversation on social using the hashtag #InvisibleGuardians. A conversation with some of the individuals featured in the documentary will be held on April 28th. So Dianne, we find ourselves in an interesting moment in time. Public health has certainly never been so visible in my lifetime. Today's webinar is one of the series we are rapidly pulling together on community health during COVID-19. We're attempting to address how we might understand and promote community health during a time when our normal routines have been upended due to the current pandemic. Luckily, we have the vast expertise of our faculty from the Division of Epidemiology and Community Health within the School of Public Health to help us make sense of it all. Today, I'm thrilled to be joined by Dr. Dianne Neumark-Sztainer, Professor and Head of the Division of Epidemiology and Community Health. Her research focuses on the prevention and reduction of weight-related problems, including obesity, poor dietary intake, inadequate physical activity, body dissatisfaction, and eating disorders. As the principal investigator for the Project EAT studies, she leads a team of researchers who have greatly contributed to what we know about eating and weight-related problems in young people. And more recently, she's begun to explore the potential of using yoga as a tool for addressing weight-related problems. She also happens to be a trained yoga instructor. Dianne, I'm so happy you can join us today. Please take it away. I'm going to close the slides and you can get started.
Thank you, Heidi. So welcome everyone, and good morning or good afternoon or good evening wherever you are in this virtual world. And I'm really thrilled to be here. I just have a technical thing before we get started. Heidi, is it possible to make the screen bigger so I'm just not seeing SPH alumni?
Yeah.
And I don't know what other people are seeing.
I think they're seeing you, but I will try to hide my block and see what happens. One second.
Perfect. I want to make sure everyone sees me. So, all right. So, as Heidi said, I'm the head of the Division of Epidemiology and Community Health, and we have a wonderful division. We have a large faculty, many students and staff, and you can imagine that during a global pandemic such as COVID-19, this is a very, very stressful job. It's an honor to be in this role. I get to be working with people who are really working their hardest to make a difference. We're seeing in Minnesota that we're going to be having more testing. We're working hard not only to prevent and reduce the transmission of COVID-19, but also to minimize the harmful effects of things such as the social distancing that we're going through, closures of schools and businesses. So I am fortunate because I'm a dedicated yoga practitioner, and I use yoga pretty much every day to help me do my work and live my life better. So today, what I thought I would do is share with you a bit about yoga, what it is, why it's important, and how you might integrate it into your life during this period. Some of you may have a regular yoga practice. Some of you have never done yoga. So you can take what you want from this, and hopefully you'll take something. And at the end, I'm going to leave time for discussion, and I'd love to hear something that you're going to take with you from this webinar. So I think first I'm going to talk a little bit about what yoga is not. Yoga is not the fancy contortion of our bodies into weird and complicated shapes. It's true, there are a few people in the world who can do that. Most of us cannot. And that's okay, because that is only a very, very tiny part of yoga. Yoga is actually a way of life. We hear a lot about the physical postures in yoga and the breath in yoga, and that's very important, and that's what we're going to practice this morning. But yoga involves much more. In the Yoga Sutras, one of the most important texts in the yoga tradition, there is talk of 8 limbs of yoga. The physical postures, which are the asanas, the breath work, the coming inward and different levels of meditation, and then the niyamas and the yamas, which are principles of living. So, for example, one of them is ahimsa, which is in Sanskrit nonviolence toward myself and nonviolence toward others. And that's very important right now. As we live through this global pandemic, we're engaging in physical and social distancing so that we do not harm ourselves and we do not harm others. So, yoga, what does it mean? Yoga actually means union, to link, to join, to yoke. And coming from a public health perspective, I like to compare the yoga perspective to the public health perspective. And I'd like to do that now in 3 ways. So we talk about yoga as linking the different bodies together. Our physical body, our mental body, our emotional body, and if you will, our spiritual body. And we do that through the way we live our life, through our physical practice, and mainly through our breath work. And when we think about public health, we think about health in a holistic perspective. We don't just talk about physical health. We talk about good mental health and good social health. And that's something now that we're dealing with. We're trying to protect our physical health, but we also need to be concerned about our psychological health. And that's somewhere where perhaps yoga can be of help. A second way that we can think about yoga and linking, this idea of yoking or linking or joining forces, is that we as individuals are linked to the greater world. We're linked to other people, and we're linked to our environment. In public health, we talk a lot about a socio-environmental perspective on health. We are influenced by other people, we influence people. We are influenced by our environment. That's why we're so concerned about climate change. And we also influence our environment. We also talk about social justice and environmental justice approaches in public health, where we as individuals don't only care about ourselves, but take steps to influence and help other people. And all of that is also very relevant now. We're really feeling that we're so linked, not only with with our communities, but with the whole world as we go through this pandemic together. And the third way that we can think about yoga is that we link to our deep, true self. So the practice of yoga, we come inward. We engage in a lifestyle that hopefully is a positive lifestyle. We engage in a physical practice, and then we engage in our breath work so that we can really still our minds. And then we can come inward and ask ourselves the big questions. What am I really here to do? What is really important to me? What is my role in the world? What brings me true joy? And it's hard to ask those questions, and it's even harder to hear the answers. And there's so much going on in our lives. How do we take that time to really come in and engage in the self-study? So if we think about this with regard to public health, we think about the whole idea of wanting to live a life full of meaning, full of purpose. And for some of us, that can be wanting to have a spiritual life. So we want to get really still so we can hear what's within us and really make a difference. So those are some of the key points of yoga. There are many, many. It's a whole body of work. And as you learn a little, and I only know a little, I become more and more aware of how much I don't know. So I have begun to engage in research in yoga. This happened really as part of my own practice. I became curious about the benefits or the potential benefits of yoga for areas that I study, such as weight status, eating disorders, body image, eating patterns, and physical activity. And indeed, we see from the research that there does seem to be a positive effect of yoga on some of these outcomes. That said, the research is pretty much in its infancy, and there's a lot more work to do. So I want to be careful in not overstating those results. There is more research, however, on areas such as low back pain, where yoga has really been found to make a difference. And for many of us who are spending hours and hours in front of our computers in Zoom meetings or Zoom social activities, it can really be helpful to move our low backs and get some stretching there. Yoga has also been found to have a positive impact on stress, anxiety, and depression, emotions that can also be coming up for us now. So, I invite you to try it out. Yoga is an experience. Try it in your body. See what works for you. So I have found that I enjoy practicing in the morning and sometimes later in the day. For those of you who don't want to get up early or have children at home and you're balancing jobs and children, probably seems like the last thing you want to do is get up even earlier to practice yoga. So I just encourage you to think what might work for you. I'm going to take you through a short practice now, and we're going to layer it. We're going to start with breath work. We're going to add some slow movements, and then we're going to come into a resting pose at the end. And I'm going to just share with you some of my favorite COVID-19 pandemic poses, and see what works for you. You can stop at any point in the practice and just engage in the practice of noticing. And this is one of the goals, is we do our practice, we notice how we're feeling, we notice what our bodies need, what our minds need, and then we can take this practice into the world. And in our real lives, notice what we need and when we can say yes and when we need to say no. Okay, so let's start. Let's get comfortable. I'm actually sitting on some pillows, and then I'm going to go sit on my mat. If you have a yoga mat, that's great. If you don't, a carpet will be good, or a blanket to put under your knees. And if you have a pillow, that's nice. So we're going to engage in a short practice now. So we're going to start by getting comfortable, feeling where we touch the earth, extending our spine up to the sky, out the crown of our head. And then we'll take our shoulders and roll them up, back, and down a few times. And if you feel comfortable, I invite you here to either close your eyes, as I'm doing, or focus on something. And let's just take a few breaths to notice. Start by noticing the noises around you. Children outside playing, children inside playing, dishwashers running. Whatever it may be, just notice. And then we'll start to bring our awareness inward. Noticing the tempo of our breath, our heartbeat, any emotions. And now we're going to take 3 big inhales through our nose and then 3 big exhales through our mouth. Now we're going to take one hand to our chest, to our heart, one hand to our belly, if that feels comfortable for you. And we'll begin just breathing in and out through our nose. Notice how your hands move with your breath. And we'll begin a breath where we inhale from the bottom up. We inhale, our belly expands, our chest rises. Exhale from the top down. Inhale, belly, ribs, chest. Exhale, chest, ribs, belly. Inhale, expansion from the bottom up. Exhale, top down. Now, sometimes it can be helpful to add a count to our breath. So we can inhale, 2, 3, 4. Exhale, 2, 3, 4. The idea being here that as we focus more on our breath, our mind has something to concentrate on. We can also layer this with breathing in what we need more of and breathing out what we need less of. Let's try that now. Taking a big inhale through our nose, and as we exhale, letting go of stress. Inhale, calm, sense of inner peace. Exhaling out stress, worries. Let's try breathing in compassion for ourselves and others. Breathing out criticism. Breathing in courage, strength. Breathing out fear. And now thinking of something, one of those or something else you need more of and need less of. And let's take 3 deep breaths and bring those in. 3 deep breaths, letting out what no longer serves us. Now we're going to add some movement to that. Keep focusing on the breath. Inhaling, arms up. Exhale, arms down. Inhale, 2, 3, 4. Exhale, 2, 3, 4. Inhale, 2, 3, 4. Exhale, hands to heart. 2, 3, 4. Now we're going to continue with our breath work, but adding more movement. We're going to come to tabletop. I like to put a blanket under my knees. If you're on a carpet, that's fine. Come to tabletop, and we're going to keep linking our breath to our movement. Inhale, bringing our chest forward. Exhale, rounding our back. Here we're focusing on both the breath and the movement, feeling vertebra by vertebra moving. Coming back to the count, coming back to the expansion and the contraction. And then you can either stay here or on our next exhale, we'll bring our tailbone down to our heels into child's pose. And then inhale, back up to tabletop. Exhale, child's pose. Inhale, up to tabletop with a slight extension of the chest forward. Let's take that 2 more times in your own breath. And this time, if you'd like, when you come up, turn your toes under, and on your exhale, pick it up into downward facing dog. Exhale, back down to tabletop. Inhale into child's pose. Let's do that a few more times. Inhaling tabletop, turning our toes under, exhaling, extending the tailbone up, extending the spine. Inhale back to tabletop. Exhale, child's pose. Let's go through that 2 more times, bringing your focus back to your breath, linking breath to movement. Tabletop, back to downward facing dog. Tabletop, and now I promised that I would show you and take you through some of my favorite global pandemic poses. So we're going to come into child's pose and stay there for a few breaths. I actually like to extend my knees outward, place my feet together, and extend forward, feeling an extension from the crown of my head to my tailbone. But some of you, that may not work. So you can take a pillow and put it under your head and come down like this. Or you could take a pillow under your feet and come like this. So this is an opportunity to see what would work best in your body. And we'll come and stay there for about 5 deep breaths. Deep inhales, deep exhales. So I love this pose because it kind of allows you to shut the world out a bit and just come into your own world. So even if you don't have time to do a full practice, you could just do this pose for a minute or 2 minutes or 5 minutes a day. Take 1 or 2 more breaths there. And then I invite you either to stay in child's pose or to come up to downward facing dog. So we'll bring our feet together. With our knees bent, extend your spine. And then, if it works for your body without compromising the integrity of your spine, you can work your legs toward extension, lowering your heels toward the ground. But it doesn't matter, your heels can be up, your knees can be bent. Feel the extension in your spine. Feel your strength. Feel yourself grounded here. And now let's come back to our breath. Big inhales. Big exhales. I'm going to stay here for about 5 or 6 more breaths. Feel free to come to child's pose at any time. What can I do in this pose to feel both strong and relaxed? Now we're going to slowly walk our hands back to our feet, come into a forward fold. And very slowly come up, vertebra by vertebra, head and neck last. Coming into mountain pose. I'm just trying to adjust this a bit because I can only see myself very small. There we go. Okay, so coming into mountain pose. There you go, now you can see me. So mountain pose, we just stand with our hands by our side and we feel the firmness of the ground below us and the extension of our crown above us. And we'll take this into a flow also. Inhale, arms up overhead. Take hold of one hand, lean to the side. Inhale up, extend up and down. Exhale to the other side. Inhale up. Now we're going to fold forward with a flat back. Bend your knees as much as you'd like. Inhale, halfway up. Exhale down. Inhale, flat back all the way to stand. Hands overhead. Exhale, hands to heart. We're going to go through that flow 3 times. And I invite you, as you learn it a little more, to really think about it as a moving meditation. It can be easier for us sometimes to focus on our breath when we have some movement. So let's inhale up. Exhale to one side. Inhale up. Exhale to the other side. Inhale up. Exhale all the way down. Inhale, flat back. Exhale down. Inhale all the way up. Gathering what you need more of and bringing it to your heart. Inhale up. Exhale to the side. Inhale up. Exhale to the side. Inhale up. Bending your knees, coming down with a flat back, giving it all up. Inhale, halfway extension. Exhale down. Inhale all the way back up, gathering all we need and bringing it to our hearts. One more time. Inhale up. Exhale to the side. Inhale up. Exhale to the other side. Inhale up. All the way down, bowing down. Halfway up. Exhale down. Inhale up. Hands to the heart. Let's take an inhale and an exhale here and just notice. Now sometimes we need strength during this period and courage to get through the days. So this is one of my other favorite poses. I'm going to take my right foot forward. I'll show you to the side. Left foot back. We're going to come into warrior one. Our left foot is a little turning out on an angle. Take your hands to your hips. Bring your hips forward. And then bring a bend to your front knee, just no further than your knee. Leave your hands here or bring them up. Let's take 3 deep breaths in this position. Feeling your strength. Inhaling courage. Exhaling fear. We could bring a flow to this too if we like. Taking our hands down. Inhale up. Exhale, hands to heart. Inhale, open. Exhale, one hand on top of the other. Take a breath in. And then we'll take that on our other side. Taking our left foot forward, our right foot just pointed a little bit outward. Hips forward, hands up in the air. Feel your courage, feel your strength. 3 deep breaths in, 3 deep breaths out. And then we'll go through the flow. Bring your hands down. Inhale up. Exhale, hands to heart. Inhale, expansion. Exhale, hands to heart, one on top of the other. Let's just leave them there and take a breath. And we'll come back to stand. We'll take one more standing pose here because we need balance during this period. You can come against a wall if you would like, either with your hand or slightly leaning against a wall. And we're going to come into tree pose. So we'll start standing on our left foot. Bring your right foot to your ankle, your calf, or your thigh, and hands in front of your heart. Look at one point on the ground. This is way too hard to do with your eyes closed. Bring your attention to your core. And if you fall out, just let it go. 3 deep breaths. Take your leg down, shake it out, and we'll try it on the other side. Standing on our right foot, our left foot can either be on our ankle, our calf, or our thigh. Hands to heart, or if you'd like, you can bring your hands up into the air. 3 deep breaths. Sometimes I like to be a tree that blows in the wind, being flexible during these difficult times. And then we'll come down. So now we're going to make our way to lie on our mats for our final resting pose. So you can come down with a flow or in whichever way you would like. And I invite you to lie on your back. If you have a pillow and like to put it under your knees, you could do so. If you have a blanket, you can cover yourself up. Just take about 20 seconds to get comfortable and warm. If you've taken off a layer, you may want to put that back on. We're going to take what's called Shavasana, a short Shavasana, which of course is one of my favorite poses now and at all times. And in this pose, feel yourself being supported by the earth. Let's take 3 deep inhales and 3 deep exhales. Breathing in through the nose, exhaling through the mouth. And now feel yourself supported by the ground below you. Feel your legs heavy, relaxed. Feel your torso, your shoulders, your arms, heavy and relaxed. Feel your head relaxed, your brain relaxed. Your whole body relaxed. Taking 3 deep, luxurious breaths here. And then I invite you to either stay here and relaxed and listen to the discussion that's going to happen, or gradually, slowly, coming to a fetal position on your right side, resting your head on your arm, taking another breath there. And then coming to sit, eyes closed, hands at your heart, either in Anjali Mudra, prayer position, or one hand on top of the other. And we'll finish by sending out thoughts, prayers. May we be protected, healthy, and safe. May our loved ones, friends, and colleagues be protected, healthy, and safe. May the whole world be protected, healthy, and safe. Namaste. So that was a very short practice, got a little bit of breath work, a little bit of movement, a little bit of relaxation, a little bit of linking things together. And I think we have time now to open it up for a little discussion.
Yeah, absolutely. Thank you so much, Diane. That was a really peaceful time for me, and I'm sure for others as well. We have a number of questions that have already been typed into the Q&A. If you have time to stay for the conversation, I invite you to do so. If not, I really encourage you to go to the School of Public Health website and look for our upcoming events. We have many, many offerings about public health in the time of COVID-19. So Diane, I wonder, could you take a moment? Mary Jo is curious about your opinion about how this epidemic will change how yoga is taught. Clearly right now it's changed things, but what's going to happen after we're allowed to gather again? Do you have thoughts about that?
That's a great question. I've been thinking about that too. So I practice yoga both at home and in a studio. I practice at One Yoga Studio, which is a beautiful studio near Uptown, and they have moved over to teaching online during this time, which is really nice because it kind of keeps me on a schedule, and we get to talk to each other virtually, and it's nice because I just get to do it in my house. I don't have to travel anywhere. There are a lot of online courses going on now. And I've wondered what will happen afterwards. Will people go back to studios or will they practice at home? And I think both will happen. I think people will go back to studios because not everyone has a place to practice at home. There's something different about practicing in community to practicing alone, and I think they both have benefits. I hope we're going to see more yoga practice. We've seen in our research the benefits of it, And we've actually, we're just publishing a study now where we're looking at people who live in stressful life situations, and they practice as much or more than other people. So hopefully people will gain some personal benefits, and if it works for them, we'll keep doing it.
So Nancy actually asked a question that I think is really interesting. She says, do you think that research on yoga would benefit from greater standardization in the specific treatment given, i.e. in how people are practicing, where, when? Can you talk a little bit about kind of the state of yoga research?
Yeah, so that's a really good question. So I go every year to a conference called the Society for Yoga Research, and I hope we'll get to go this year. It's at beautiful Kripalu. And that's a big topic that comes up. So, what is yoga? Yoga could be many different things. Personally, I think there are more similarities than difference because of what I spoke about at the beginning. But, are we talking about one session? Are we talking about every day? Are we talking about mostly breath work? Are we talking about mostly physical movement? And those are absolutely things that we want to look at in our research. And more when we publish about yoga interventions, so we've published about yoga and body image, they wanted to know what exactly we were doing in our intervention.
Interesting. Do you, from an epidemiological standpoint, when do you think community yoga will be able to happen again? Have folks been thinking about how to do yoga in groups safely, and what's it going to take to kind of get us together again?
That's the $20 million question. Yeah. If I knew that. I mean, how we started at our yoga studio was they actually marked with tape, so people were 6 feet away from each other. And that's what I think the first step will be, people coming back and having to maintain social distance. The big thing that's going to have to happen, I mean, not only for yoga, but everything, is we're going to have some testing going on so we can identify, and this needs to be the #1 priority in my mind, so that we can learn more about who is at risk for themselves and for spreading to others. And that will then allow us to gradually move back into society. And I mean, yoga is important, but there are many other things, such as schools, that are absolutely vital to our society.
Absolutely. One of our listeners asks, what yoga apps or websites do you recommend for beginners? Do you have any thoughts for folks just getting started?
So, I mean, I have to say that I think getting started, it's really important to work with a teacher, because then you can get feedback going on. And actually, that is how yoga was originally designed, to be taught on a one-to-one level. So I never really used apps until now. I practice, but I have my own practice. And the one that I have subscribed to now is called Yoga International. And that is, that has a whole range of levels and durations and teachers. So you could go there and really look for a beginning yoga class. Here in the Twin Cities, we have lots of great yoga studios. I talked about One Yoga. We have the Yoga Retreat Center. We have Tula. We have many opportunities, and you can look there. And I would encourage people to actually call a yoga studio and say, this is what I would like. They may do online one-to-one if that works for your budget. Otherwise, looking for a beginning class. And what we did today was pretty accessible, probably to most people, particularly the breathing, and that's where I would start.
Great. Dianne, I think we can take one more question, then we're kind of running out of time. Robin asks, how are you seeing yoga impact body image in your research?
Yeah. So we've looked at this in a couple of ways. Through our Project EAT study that I lead, which is a longitudinal cohort study, we've looked at associations with practicing yoga at a population-based level and changes in body image over time. And we have found that people who had poor body image to begin with and practiced yoga showed better body image scores afterwards. And that's important because we didn't know if perhaps people who had poor body image would actually get worse when they went to a yoga class. But the data, I mean, they're observational, but they suggest that yoga could be helpful. I want to say that it always depends. And I'm very picky about classes that I go to. I choose classes where the teacher uses language that helps me feel good about myself, gives me permission to choose to do poses in accordance to how I'm feeling that day and how my body is feeling. And even though I'm an experienced yogi, I still like when my teacher gives me that permission. And then we've done some intervention work, which is really where you want to go with your research, to do some randomized controlled trials to see how yoga is influencing body image in the regular population, in college-age students, and among those with eating disorders.
Fascinating. I wish we had so much more time than we have. If it's okay, I'm just going to share again some of the upcoming events that we have available to those of you listening today. So I think, I'm sorry, just a moment. These are the other community health during COVID-19 webinars that we have planned. So Diane's colleagues will be helping us understand other facets of community health in a pandemic. The next one we have scheduled is May 7th. And then we have an abundance of virtual learning opportunities through the School of Public Health right now. You can find out more about the COVID-19 specific ones online. Here are just a little snapshot of what's coming up. And then in addition, if you are part of the School of Public Health community, you can check out the events calendar, and there are lots of non-COVID related events happening as well. So thank you again, Dianne Neumark-Sztainer, head of the Division of Epidemiology and Community Health and professor and yoga instructor. I really appreciated your time today. Thanks to all who joined us.